Hello and welcome to the after show of House Calls. I'm your host, Dia Smith Taylor, and this is the show where we talk about the questions that our audience had after our live show. And so we're back today talking about diabetes. What an important conversation. And back with us is Dr. Joshua Joseph, here to answer more of your questions. Thank you for coming back, Dr. Joseph.
Thank you.
We really did have a very engaging and lively show. Diabetes is an issue that affects so many people. And so we just have a few more pressing questions that our audience had. And I'd like to start with Anton Keller, who wants to know, why exactly is exercise in particular so important when it comes to diabetes prevention?
Yeah, so exercise is really important in diabetes prevention and in diabetes treatment. So as we were talking about a little during the show, one of the key leaders to type 2 diabetes is really insulin resistance. So that hormone insulin we talked about how it binds a sugar and it transfers that sugar across the blood vessels and into the muscles and the kidneys and the heart and the brain, everywhere where we need sugar to go. So what exercise does is it decreases that resistance to insulin, and it makes it so that the insulin can work much more efficiently. And so that is why exercise is important, not only in diabetes prevention, but also in diabetes treatment. And so aerobic exercise is important. We've also seen some benefits to resistance exercise, and some people do high intensity interval training. All forms of exercise are really important to diabetes prevention and treatment.
So that's really helpful information. And it's good to know, because it's not just about once you have diabetes, but also preventing it in the first place. And when we think about food and exercise, food in particular, people have so many questions about, how much are we really being told the truth? And so Orlando from LinkedIn wants to know, I like this question, do nutrition facts in food labels have the real information about sugar?
Yeah, so, the nutrition facts are really mandated to have the real information. So that is information that we can all trust when we go to that label. I think, in addition to your question there, is the second piece of that is, when we eat out or when we're eating in restaurants and other places, at least for me, I find it so much more difficult, right, to figure out, what's high calorie, what's low calorie, what's high carb, what's low carb. But so there are different environments where it's tougher, but we can trust those food labels.
Well, that's really good to know, because sometimes, you do question it. So it's good to know. We've heard it from the doctor. So you guys, we're in a good place there. This next question actually comes from a doctor. Dr. Sadiq wants to know, how do we control insulin, or how does he control insulin resistance once a patient has been admitted?
Yeah, so Dr. Sadiq is, as this person knows, when people are hospitalized, there are many things that happen. And some of these things that can happen, let's say that, for instance, someone has a heart attack or requires a surgery, right? These things can increase stress on the body, and the stress hormone, right, that we all have that increases is called cortisol. So, if I were to see, for instance, a bear in the woods, my cortisol would go up, right? And when my cortisol goes up, my sugar goes up as well, so that I can be prepared to run as fast as I can. Although I know I'm not supposed to run, right? I'm supposed to lay on the ground and curl up in a ball. Well, that same thing can happen in the hospital, where cortisol rates can go up. And so there are some approaches that people have used with, for instance, massage therapy, or with talk therapy, or with aromatherapy, or Reiki therapy. All therapies that we can do in the hospital to relax patients and lower cortisol levels. And that can combat the insulin resistance. We also, use medications effectively in the hospital too, when we need to. So, I'm thinking about, for instance, people sometimes have coronary artery bypass surgery, where we put in kind of new coronary arteries. Oftentimes, for a couple of days after the surgery, they will have higher insulin requirements due to that insulin resistance. but then it does start coming down over the 2 or 3 or 4 days back to their normal levels.
When you were talking about all those therapies, I wanted to go get a massage.
Yeah, so do I.
I'm ready. So Bhavika wants to know, does diabetes cause a heart attack? And you kind of talked about this a little bit during our live show, but clearly it's a question that people still want to know about.
Yes, so that's a great question. And we do know that individuals with diabetes do have higher rates of heart attacks, strokes, and really death from heart attacks and strokes as well. And so, why is that? Well, one of the factors, particularly in type 2 diabetes, is that as those blood sugars rise, they can damage the blood vessels, right? And so, that sugar kind of hitting on the blood vessels over a long period of time does lead to increased damage of the blood vessels. And those blood vessels are really, those are critical. I mean, they transport all the blood throughout the body. And when they are damaged, that is when we really see that you can get something we call plaque or kind of fatty buildup in those blood vessels, which over time can lead to a blockage of the blood vessel or what we call a heart attack or a stroke. The second part of it is that we know individuals with diabetes are more likely to have high blood pressure, are more likely to have high cholesterol, are more likely to have an elevated weight. All things that also increase risk of a heart attack or a stroke. So there's really a combination of factors in diabetes that put someone at higher risk of a stroke or a heart attack. The great thing is that we have opportunity to really modify all those risks through those things we were talking about during the session: physical activity, diet, sleep, stress management, all pivotal in diabetes and cardiovascular disease prevention.
We have one more question, but I have one of my own as well, because I'm wondering during this time of COVID, many of us have, not been moving as much. We've been eating comfort foods and things of that nature. Are there things that you've seen on the rise during COVID as it relates to diabetes?
Yeah, it's really been a mixed bag. And so for one, that's a fantastic question. But I've really seen a mixture where some individuals, because COVID has forced us all to eat at home, right, are actually eating healthier now than they were. Let's say they're, a businessman or woman, and they were having, 5 or 6 meals per week, out at night. They're actually doing a little bit better with COVID, right? Other individuals are struggling a little bit more, right, because of this stress that we're all experiencing with COVID. So I've really seen a mixture. It's not all in one direction. Some people are doing a little better. Some people are struggling a little bit more. When we're related to physical activity, some people are at home now, so they have a little bit more time, for physical activity. Let's say that, if you live in one of our major cities around the country and you have an hour and a half commute to work, well, you just got back 2-3 hours in a day, which allows you the time to do some of these healthier habits that are so important. And so I've really seen a mixture there.
Really great points. And you're right. I certainly have been cooking more, for better or for worse. I have been cooking more at home. And so our last question is from Dwight Abrams, who wants a reminder of those 7 tips for prevention that you shared during the live show. Can you talk to us about that?
Yeah, so it's Life Simple 7. And so there are 7 factors that we think about. So the first 3 all begin with blood. So they're easy to remember: blood pressure, blood cholesterol, and blood glucose. The third one in the middle is body mass index or weight, right? And then we have some modifiable behaviors, including smoking, physical activity, and diet. And if you have problems remembering it or you can't remember it, you can go to joshuajosephmd.com, and we have them prominently on our website because we think they are so critical to both diabetes and cardiovascular disease prevention.
Great. That's been really helpful. Thank you so much for coming back on the after show with us. Dr. Joseph to answer more questions, because that's what we do here. This is House Calls, and we're here for you. So thank you for joining us. Join us again next week. We'd love to hear from you and love to have you with us. And until the next time, stay safe.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.